Roughly 14 million
Absolutely.
have chronic obstructive pulmonary disease or COPD, a lung disease that can make it tough to breathe. Many people live with relentless worry about their next flare-up, which sometimes can lead to hospitalization. Now, joining us now to talk about helping patients better manage their disease and potentially reduce the number of flare-ups is pulmonologist, if I'm saying it right, Dr. Alexis Smith.
Alexis,
Alexis.
Yeah,
Yeah,
you
it's
got it.
morning. It is definitely. Doctor,
I've been there.
yeah, tell me about it. And I've had coffee too, so that's the bad part. So, doctor, can you define COPD for us and tell us who it impacts?
Absolutely. COPD is a disease that affects the lungs, causing inflammation and damage to the lungs, making it difficult for patients to breathe. We often think about it being caused by smoking, active smoking, but even if you quit smoking decades ago, you're still at risk of COPD. Smoking is not the only risk factor. There are other environmental factors and other things you may have breathed in that could lead to COPD as well. So talking to your doctor is important. I also think it's important to explain to patients that COPD is a progressive disorder, meaning that it can continue to get worse despite taking your medication. So checking in regularly to make sure you're doing everything you need to do is of importance too. Because in Missouri alone, there's over 400,000 patients living with COPD, and it's one of the leading causes of death in the United States. So being able to shine a little light on COPD is my absolute pleasure to educate the masses today. Thanks for your time.
Well, thank you for joining us, Dr. Alexis Smith. So, what are some of the major challenges COPD patients experience?
So, as pulmonologists and doctors, we prescribe medications breathed directly into the lungs. Those are called maintenance inhalers to try to calm down the inflammation of COPD. But we know that even when patients are doing their best and taking them regularly, almost half of patients are going to experience flare ups. These aren't just inconvenient, they lead to more flare ups, more severe flare ups, and even hospitalization. What we realize is the driving factor of these flare-ups is a type of white blood cell called an eosinophil. And now we have a simple blood test which can tell us a level of eosinophil and which patients therefore may be at risk of these flare-ups.
So, what is the latest development or a development on the horizon that could help COPD patients with flare-ups?
And here's where it gets exciting, James. So the latest development in pulmonary medicine is the use of biologics for COPD. These are medications injected under the skin in addition to inhalers to try to combat the inflammation of COPD. I'm here on behalf of GSK to specifically talk to you about Nucala or mepolizumab. It's a biologic medication indicated for adults with inadequately controlled COPD and an eosinophilic phenotype. What does that mean for you or I or our patients? It means that patients have to have a diagnosis of COPD. They have to be on their inhalers as prescribed. They have to still be having symptoms and flare-ups, and they have to have that inflammation from those eosinophils, that blood test we talked about. If your patients have those, you may be a candidate for a medication called the biologic or Nucala specifically. Now, as with all medications, you can have potential side effects, and some of those can be serious, like anaphylaxis or certain infections. Talking to your doctor about your medical history and any side effects you're experiencing is really important.
Now, what are important questions that people living with COPD should be asking their doctors?
I hear great questions from my patients. I hear, is there anything I can do to modify my COPD? Diet, exercise, sleep patterns. I hear, am I on the right inhaler? Am I taking it appropriately? What is a trigger? How do I avoid flare-ups? And specifically, where do I go when I'm not feeling my best? Do I go to the hospital, an urgent care, my primary care, or my specialist? All of these are great questions to talk to your doctor about to try to get your COPD under control and a little more knowledge.
Now, what are the key takeaways you'd like the audience to remember surrounding this particular topic?
I think it's important to realize that COPD is diverse and complex, but each person's experience is completely individualized and unique. And so talking to your doctor, explaining your medical conditions, what you're feeling, what your lifestyle and environment are, they're going to be able to help navigate you through this journey of COPD. It's not something we can cure, but it's something we can work together to maintain the highest level of wellness. And that's that doctor-patient relationship.
Let's speak with Dr. Alexis Smith, talking about COPD. But one of the last things I got to ask you, doctor, is they keep talking about startups and innovations and all this great stuff going on. Let's talk about innovation in medicine real quick.
All right. I'd be delighted to.
Talk about COPD.
Startups and innovation.
Yeah, the innovation,
Yeah.
the new, yeah.
So one of the great things that we're doing in COPD is looking at how structure interacts with function, interacts with cell signaling. And so what's happening as you breathe in air, the lungs are starting to interact with that environment. And we learn on that some signals turn on and wreak havoc, and we can turn those back down. And all the different biology behind that is very, very interesting. And so I encourage you to read more about it, talk to your physicians about how those cell signals work and if they'd be right for you.
Dr. Alexa Smith, thank you so much for joining us on Morning Blend. It's always a pleasure. Thank you.
James, thank you so much. Have a great day.
You too.